Gestational diabetes together with oral glucose tolerance test, OGTT. I want to combine those together so that you can get the concept. Gestational diabetes, gestation means the actual virtue of carrying a baby and giving birth, all that thing, okay? So gestational diabetes is the type of diabetes that you get when you're pregnant, specifically 24 to 28 weeks of carrying the pregnancy, okay? How does it happen? Okay, so during pregnancy is maintained by something called hormones, or in this time, hormone levels are high. Examples are cortisol and estrogen and other hormones. Okay, so how do these hormones bring about gestational diabetes? They bring something called insulin resistant. You are resistant to your own insulin. Okay, very nice. So insulin resistance brings about an increase in sugar levels. Okay, diabetes is the fact that you have uncontrollable sugar levels. Okay, and at this point, if you are having insulin resistant, your sugar levels are going to be high, and that is how you end up with gestational diabetes. So, what are the side effects of gestational diabetes? Too much sugar, you're going to cause something called macrosomia. Macrosomia is big baby. Big baby equals birth problems. Okay, you have having a macrosomia is a big baby. Now that brings about problems with giving birth. I will gather. So, how can you know that you're suffering from gestational diabetes? Number one, you do a fasting blood sugar, you do random blood sugar. It's going to tell us the sugar levels. You do a urinalysis. Urinalysis is a part that is written glucose. It's going to tell us your glucose levels. Random blood sugar is also going to tell us your sugar levels. Very nice. So, what test can you do to determine that you are suffering from gestational diabetes? Number one is called OGTT. OGTT is oral glucose tolerance test. And this is how it goes. You first of all have to, what is it called? Starve for 8 to 12 hours, okay? Before you come for the test. When you come for the test, we do a fasting blood sugar. A fasting blood sugar should be 5.1 millimoles per liter. Anything above that is abnormal, suggesting that you're having gestational diabetes, okay? Then we are going to give you 75 grams of glucose or 100 grams of glucose. Okay, you have fasted for 8 to 12 hours. You come to the lab, we do fasting blood sugar, and then we give you 75 grams of glucose and 100 grams of glucose. Are we together? So if you had fasted for 8 to 12 hours, if we give you glucose, see, your body should be able to use that glucose. And pregnant women are always hungry, okay? Because they need so much energy to maintain even the unborn child. They need too much energy. So if we give you 75 grams of glucose, you're supposed to partake that very fast, okay? So after us giving you 75 grams of glucose, we give you 1 hour, then we repeat the random blood sugar, okay? It should be between 10 millimoles and below. Anything above that suggests that you're having gestational diabetes. Why? Why are you having more than 10 millimoles per liter of glucose and you had starved for 8 hours? It means that your insulin is not working. Okay, because it's the work of insulin to help this glucose to be assimilated into the cells. So if that is not happening, it means you're having insulin resistant. Why? Because of hormones. Okay, and that leads to translate to gestational diabetes. Are we together? We test that after 2 hours, it should be 8.5 millimoles per liter and below. Anything above that is a problem. If we check your urine, we should not find glucose. Why are we finding glucose and you had starved, fasted for 8 to 12 hours and you're a pregnant woman? You should be assimilating this glucose very fast. That is also going to help us understand why you're not assimilating glucose very fast. Are we together? So that is called OGTT, and we do it at our lab to determine if you're suffering from gestational diabetes. If we find that you're suffering from gestational diabetes, you're supposed to take that report to your doctor, and your doctor is going to help you with that problem. Okay. Some people, when the pregnancy is over, they have given birth, they go back to normal. Others get some complications. So welcome to our lab. Let's give you this checkup, and let's take that to your gynecologist, and let your gynecologist handle that process. That is OGTT and gestational diabetes. My name is Peter Gomba. We are located in Zambezi. Our lab is called Microafia Laboratory Clinic. We do all types of tests. See you on the next one.